केडी हॉस्पिटल वाली को।
Good afternoon, everyone. I request all the participants to kindly rename their devices to their original names. I request all the participants to kindly rename their device name as of their original names, as we will be starting soon and we are waiting for few of our participants to join.
A kind reminder that today's sessions include an interactive breakout room activities. Therefore, I request you all to remain live and actively present throughout the session. Your involvement will make the session more engaging, interactive, and beneficial for everyone. Good, good afternoon, everyone. It is my privilege to welcome all our distinguished guests, our respected resource person, healthcare educators, academicians, researchers, faculty members, and participants to day one of the Virtual International Faculty Development Program series titled Teaching Beyond Textbook: Practical Strategies for Student Engagement and Faculty Wellbeing in Healthcare Education. I, Ms. Smita Kindo, Associate Professor at KD Institute of Nursing Sciences, on behalf of KD Institute of Nursing Sciences, I extend a very warm welcome to
Mita, you are not audible.
now. Good afternoon, everyone. It is my privilege to welcome all our distinguished guests, our respected resource person, healthcare educators, researchers, faculty members to day one of the Virtual International Faculty Development Program series, Teaching Beyond Textbook: practical strategies for student engagement and faculty well-being in healthcare education. I, Ms. Smita Kendo, Associate Professor at KD Institute of Nursing Sciences, on behalf of KD Institute of Nursing Sciences, I extend a very warm welcome to each one of you. Now, I respectfully invite Dr. Chris Thomas, Sir, Principal of KD Institute of Nursing Sciences, to address the gathering and share a few words about the International Faculty Development Program.
Thank you. First of all, I share my greetings from Ahmedabad, KD Hospital and KD Institute of Nursing Science, KD Institute of Physiotherapy, and KD Institute of Optometry. We heartily welcome you all for this International Faculty Development Program. It gives me immense pleasure to welcome nursing, physiotherapy, optometry, allied health, and other health educators who have joined us from different institutions and regions. Over the past few years, the role of a healthcare educator has changed dramatically. Today, our challenge is not merely to complete the syllabus, but how to engage the learners differently and learn differently and expect a different classroom experience. Sometimes the educators, I mean healthcare educators, they used to ask such questions. Sir, how do I motivate today's students? How do I make my class more interactive? Or how do I mentor my students, those are facing emotional challenges, while also taking care of my own well-being? So this faculty development program was assigned in those responses to address this kind of challenges. And rather than focusing on some theoretical class, we want to provide some practical evidence-informed strategies that can help educators to apply immediately in their classroom. And we are delighted by overwhelming response to this program. And we have got huge number of participants, not only from nursing, but from physiotherapy, optometry, and other disciplines. This reflects a shared commitment across healthcare education to teach more good practices and support both educators and students. And we know these sessions has been thoughtfully designed to include interactive activities, reflection, practical take-home ideas, not just simply lectures. So I encourage each participant to actively engage in every session, ask questions, share your experience, and take back at least one new idea each day that can transform your teaching practice. So together, let us beyond the textbook and create a learning experience that inspire the next generation of healthcare professionals. Thank you so much.
Thank you, sir. Whether teaching in a physical classroom, simulation laboratory, clinical setting, or virtual environment, educators often encounter challenges such as disengaged learners, late arrivals, classroom disruption, or varying level of participation. Managing this situation effectively is essential for creating an environment that encourages learning, professionalism, and mutual respect. So today's sessions are on classroom management skills for healthcare educators. It is now my privilege to introduce our esteemed resource person, Dr. Gorang Bakshi sir. He is a distinguished physiotherapy educator, academic strategist, and lifelong learner. Sir is a currently vertical lead Faculty Development Academy in Chakra, Nasik. He also served as a treasurer of the Academy of Health Profession Educators of India. He has done PhD in physiotherapy and femur fellowship. Sir has 16 plus of year experience in physiotherapy education, medical education, and faculty development. Sir is expert in competency-based education, assessment, and curriculum development. He has also authored of 95 plus publication and 5 books, recipient of 35 plus national awards, delivered 250 plus invited faculty session and holds 1 research grant, 1 patent, 5 copyrights, 3 national or international world records. We are truly honored to such an accomplished academician and educator leader with us today. So please join me in extending a warm virtual welcome to Dr. Gaurang Bakshi sir. Sir, the virtual stage is all yours.
Thank you, ma'am, and thank you, KD Institute. Thank you, Dr. Chris Thomas, for having me in this presentation today. Allow me to share my screen, please. Yes, can you all see my screen? Can somebody confirm?
Yes, sir.
Yes, sir.
Yes, thank you so much. So, a very interesting topic to begin this entire series of sessions, classroom management skills for healthcare educators. And I think when Dr. Chris Thomas first contacted me of asking to take such a topic, it was interesting to understand this perspective that yes, we as educators and teachers are often boggled down by our students in the classroom. So, how to manage our difficult students? So, that was the dialogue which we had, and here we are to kind of engage and discuss on that topic today and see how or what we can do to address these challenges. So, what we will do in today's session, identify common classroom management challenges, see certain strategies and apply them to handle destructive behaviors, encourage participation of students using active learning, and create classroom norms for respectful learning. Okay, so first of all, you can use the chat box or maybe just show hands. If any of you have, as teachers, witnessed or the following things which happen in the classroom. Students using mobile phones. Can we have a show of hands? How many of you have faced this? Okay, response is coming up. Wonderful. Next scenario, students coming late repeatedly. Okay, students who never answer questions. Slowly the hands are coming up. Okay. One student dominating every discussion which you conduct in your class. Fine, yes. Students talking amongst themselves in the class while you're teaching. Okay, many of you have expressed, for instance, sleeping students. Just not interested, or maybe actually sleeping or dozing off in the class. Okay, so as a teacher, I want which of these situations frustrates you the most? I would like to elicit a couple of responses from you. Can somebody kind of unmute and share your experiences? Which of this is most frustrating? We will wait for some responses. The session is going to be interactive, so I would request somebody to unmute and share your experiences.
So,
Hello, good
as a
afternoon, sir.
teacher, I feel students who never answer questions are the most problematic students.
Okay. Thank you, ma'am. Someone else?
Students using mobile phone during the teaching, that is the biggest.
Okay, and beyond these points which are just listed out, any other points, any other issues which students do which kind of irritates or bothers you if it is not
Using
mentioned over here?
AI, using AI for the notes and not paying attention to the physical classrooms.
Not paying attention. Yes, why using AI? Why does that bother you?
The books are not being referred, the
Mhm.
correct references, and because of that, the false education is being, the students are learning.
Okay, so are you saying, ma'am, suggesting that the students are using AI in the classroom?
No, 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 not classroom, but because of that, the teaching is getting, students are not interested to learn in a physical classroom.
Okay. Someone else? The over 70 participants in the group. Can we have a few more responses of any other points which the students do, which kind of bothers you as a teacher? We will wait for one more response at least. Does this happen when you ask a question but students don't respond? Like the way I am asking a question right now to the group and everybody is silent.
Sir, they do not refer the standard books. I mean, they are more towards, using slide share and like ready-made PPTs, but they don't want to take any effort to use the standard books or refer the standard books of our field.
Okay, fine. So I think everybody agrees and has faced some or the other issue when it comes to managing their students in their classrooms. Okay. So now I would want you to reflect and think of your experience as a student. So I want you to think about your best teacher. Okay. Reflect on your experience about your teacher whom you still remember as to be the best teacher. So what made you want to listen more to that teacher? Think about your best teacher. What made you want to listen more? This entire session is going to be interactive. So unless you engage and participate, we will not be able to move ahead. Okay, we have some responses in the chat. The session, Anjali ma'am has mentioned the session being interactive, goal-oriented teaching. Teacher made the topic interesting. The flow of the lecture, okay. Explaining real life situations, yes. What else? What
Mm,
else?
So it was the about practical examples.
Okay, sharing real life practical examples.
Yes.
Somebody's mentioned the whole class was in English, so I want to learn English from her. Okay. Teaching from real life examples, showing videos. Nice. Any other memories which you have, which you feel made your session, your teacher most effective? Okay. And in your experience now, what makes students more difficult? Difficult to deal with, difficult to manage in the class. You have already enlisted out the best attributes of your teachers which you recollect. And now, if you can reflect, what makes students difficult these days? Why do we find it difficult to connect to them? Of course, you did mention we saw if the students do, which kind of annoys us as teachers. Why do the students do this? What do you feel? Students can't focus. Okay, responses coming up on the chat. They all rely on chat GPT. Okay. Not all teachers. Students always want shortcuts. Students having a casual approach. Yes, interesting. And I think that is everybody will relate to it. Students are having a very casual approach these days. They only want to focus on examinations and they are not keen on getting knowledge. They learn only to give exams. Yes. Goal of the students is not to gain knowledge, just want to pass through a grade.
One thing that I find really makes it difficult for students to take with is
So somebody is having two mics on two audio sources, so there's an echo coming. If you're not speaking, can I request you all to be muted? Yes, please go ahead. Is somebody speaking? We are not able to hear you clearly.
Hello,
Yes,
am I
sir.
audible, sir?
Yes, sir. Please go ahead. Yes, sir. Please
Hello.
go ahead. You were saying something?
One thing that I find, makes student behavior a little erratic is that we tend to be very quick to judge them because of the differences that we have.
Okay, so we as teachers are becoming judgmental, and that is what makes their behaviors erratic. Okay, interesting perspective. So finally, we need to understand that classroom management is not about controlling students, but it is about creating conditions where learning can occur for the students. So if you reflect whatever earlier points you all mentioned about why you think your teacher was the best, all those teachers made efforts to make your learning more effective. And I think that is what caught your attention, and you still remember your teachers at those sessions and the lectures. So, some principles of effective classroom management. First, we need to understand that we need to try to prevent the problem even before they occur. So, how do we do this? A few tips. We need to first set the expectations right in the beginning. Establish some ground rules together along with the students. If you involve your students in making the ground rules that, okay, these are the rules which we would like to follow, the chances are higher that the students will kind of adhere to those rules. Learn the students by their names. If you call out the students by the names, if you remember their names, they will kind of feel that personalized touch, and the chances are higher that they would uh, give more attention to what you have to say. And of course, we as teachers need to arrive prepared for whatever class or session or lecture or practical or any kind of a teaching learning encounter which we are going to do. Second principle, and we did discuss this, we need to maintain engagement with active learning strategies. So you can use strategies like think, pair, share. You can use polls during your session, explain clinical scenarios, give demonstrations where required, allow opportunities for peer teaching. Basically, remember that today's generation of students will remember and be engaged more if they are participating in the learning process. Just taking lectures for them doesn't really help them. You need to create scenarios and opportunities where they are engaged for their own learning. If you are successful in doing this, the chances of having a smoother classroom environment increase drastically. Next, respond as a teacher, respond calmly and professionally in case of any situation where arises with the students. Use a calm language, avoid public humiliation, correct the behavior of the student and not the person. So many times, one common mistake which we end up doing is we become judgmental and we give labels to the students. But rather than labeling a student to be mischievous or naughty or not interested, we need to correct their behavior and don't blame the person directly. And finally, build respectful teacher-student relationships.
અને એનું પોસ્ટિંગ મહાગુજરાતમાં સિનિયર સિટીઝન.
તો વાંધો નહીં, એના પપ્પાને કહી દેજો કે આગળ મેનેજમેન્ટમાં બી વાત કરી લે કે ડિમ્પલ મેડમને સેલરી બી 10 ગણી હોય.
Yeah, can we mute those participants? Yeah, okay, thank you. So the final point, one important point to submit up. Students will be more cooperative with the teachers whom they trust. So if we're able to gather their trust, the students, the chances are higher that they will not become a nuisance in the classroom. Now, I had a group activity planned, but there seems to be some. Sir, are we able to have a breakout room? Can the administration host advise? Is it possible to have a breakout room activity? Dr. Chris?
Sir, actually, breakout room facility now it has been enabled. We have found actually because it was not pre-told. Na? So can everyone please rejoin again? They can go outside and again rejoin. So we can have it's just a 1 minute.
Okay, so let's just disconnect and join back again.
Everyone can. I request everyone to please disconnect yourself so we can rejoin again.
Yeah, let's do that.
ये कोस्ट है ना आप लोग की?
Welcome back, everyone.
Yes, sir. Sir, now you are co-host, na? एक minute, let me see.
So the host should be able to create the breakout rooms.
Okay, fine. अच्छा, आप लोग host में
So can you give me host rights? I will try to just do it.
Yes, sir, we are trying.
And don't send the participants yet. I have to give them instructions. I think you've already opened out the rooms. Okay, so in the meanwhile, I would request the participants, we will now break down into different rooms. Can everyone hear me? Can somebody just confirm?
Yes, sir.
Yeah. So what I want now, we will break down into 5 rooms. Please take a photograph of this screen so that you all know what you have to do in the room. Okay, so every room will have one scenario. For that scenario, the group members have to discuss about what is going on, why this must be happening, what can be an immediate response from you as a faculty and managing the class, and what would be certain long-term strategies which you would want to use to ensure that this does not happen again. Okay, so each group will get around 10 minutes to discuss the issue which is being going to be presented, and then identify one person who will come back and just quickly in 2 minutes report what is going on. Okay, so just take a photograph of this screen. And the next screen as well. So these are the different scenarios for the 5 groups. You can take a photograph again. So group 1 will discuss scenario 1, group 2 scenario 2, room 3 scenario 3, room 4 scenario 4, room 5 scenario 5. Okay. I think certain breakout rooms are already created. So I have closed that room and we will create the rooms again. Let everybody come back. In the meanwhile, I would want you to take photographs of these slides, and we will start with open the breakout rooms once again in a few minutes. Few members are already in the breakout rooms, so let's just get them back out, and then we'll reallocate the rooms to you. Okay, so just for everybody's information again, these are the instructions which you need to do. You can take a photograph of this screen now that everyone is back in the main room. We will divide you into 5 groups. Each group has to discuss one scenario on the following points. Discuss what is happening, why that might be happening, what can be your immediate response, and what long-term strategy you would like to suggest. So the groups can discuss for 10 minutes and one speaker can come back and present the solution in 2 minutes. And here are the scenarios. You can take a photograph of this slide as well. And now I will send you all into Okay, now we are opening the rooms. You will get a message to join your group, requesting everyone to accept that message and join the room which has been allocated to you. Move into your breakout rooms and have this discussion. And we will come back to the main plenary in 10 minutes. Identify who would be speaking from each room. Everybody who is still in the main room means they are not actively engaged with the online session. Only those who are moving into the rooms are actually active. Only 24 people have moved to the rooms and they are active. Sir, everyone over here are probably not active. The active members are in the breakout rooms.
Yes, that is why, sir. I don't think so. If you are not.
Yeah, all these people are just turned on their Zoom and yeah. Can I have lost co-host rights, so I will not be able to control the room yet. Can I be made host once again?
Host? Okay, sir.
I will hand over host rights once the breakout activity is over.
Okay, okay. I have changed, sir. Yeah.
Yeah, now I can see the breakout rooms.
Yeah.
Yes. So breakout rooms are one more tool to ensure participation.
Yeah.
Room 1 and 2 have only 3 active members. 3 as well. I think maximum discussions are going on in group 4 and room 5.
In the group also we have the WhatsApp group also we have created, no? So there also you have put the same question. So they have not missed the question, so they may discussing.
Yes, I had put it on the as a broadcast chat as well.
Yeah.
We will allow the participants 1 more minute, and then they can join back.
Sir, you need to close the breakout room, then only they may join back.
Yes, I know. So after closing, they will get 1 minute
Yeah,
to
automatically they will come to main room. Yeah.
Okay, so I've closed the room. They should all be back in 1 minute.
And after that, you may please make us host. So
Yeah, I will already do that right now. Which one? Which ID? The
KD Hospital. KD Hospital.
Yeah, let me do that. KD Institute?
No, sir, KD Hospital.
I can't see that ID.
KD Hospital, sir.
Sir, I'll make you host. You can just assign whomever you want to.
Otherwise, KD Institute you can make, sir. No issue.
Okay. And make me co-host too. Okay, so everyone is back. So before we go ahead with the presentations, now I would request every one representative from every group to please unmute and turn on your camera, and please in 2 minutes mention what was your scenario and what did the group discuss about it. Group 1. There were 3 or 4 people in group 1 who were actually there. Can somebody share what was discussed? Group 1, this was the scenario. 3 students keep chatting throughout your lecture. What will you do? Can any group 1 participant unmute and share what was discussed amongst yourselves?
Hello, sir.
Yes, ma'am. Please go ahead.
So if students are chatting throughout our lectures, then we can engage them in some activities which is more interesting, and we can divide them into different groups and give some activity-based learning or role play kind of thing we can
Ma'am,
give.
so sorry to interrupt, ma'am. Did you discuss on these points what is happening and why it might be happening?
Sorry, sir.
Yeah, can you share, did you as a group discuss on these 4 points on that scenario?
No, sir. I'm just giving my answer that what all things can be done if such situation happen inside the classroom.
Okay. Yeah, please go ahead.
So we'll have to see during the classroom what is the distracting factors and why they are not engaged. So if it is from our side, then we'll have to change our uh, view on taking lectures and then PPT and the way we take sessions in our classrooms. So whether it is from our side or from their side, if it is so, then we'll have to demonstrate or class based learning or practical based learning or group activities. So those kind of thing can be done to minimize these things.
Okay. Yes, thank you. Anyone else would like to add from group 1? Okay. Thank you, ma'am. Group 2. This was the scenario. A student openly challenges your explanations in class. Can anyone from group 2 share what you discussed? Did you all discuss within your groups or no? Who all were there in group 2? Can somebody unmute and share what you all discussed? And if you have not discussed anything, please let us know you have not discussed. Then we can move ahead. Okay, probably something in the chat. Not discussed. Okay, group 2 did not discuss anything. Fine, let's move to scenario 3. Half of the class arrives 15 minutes late after the break. Okay, so now probably nobody even group 3 also has discussed. I can see a message on the group. So we don't know what you all did for those 10 minutes. But if somebody would like to, we'll come to group 4, but group 3, if somebody would like to just still now on the floor mention what your thoughts are, we can take those. Okay, we'll move on to group 4. Because group 4 and 5 were the ones who were actually kind of engaged. Like we could see that. Somebody has put up a comment on group 4, but would you like to unmute and share?
So myself, Kavita from Coimbatore.
Yes, ma'am.
So I am representing group 4. Actually, we started the discussion by the time the classroom time got ended.
Okay.
So I work as a professor in Sri Abhirami College of Nursing, Coimbatore.
Yes, ma'am.
1 minute, sir. Sorry, sir. Okay, sir, regarding our scenario, no one answers your questions. The class remains silent. So the first thing, hello?
Yes, ma'am. Please go ahead.
Yes, yeah. First, what we tried is what is happening. So what is happening is I asked the question, the classrooms remain silence. There is no response back from the students. Why might it be happening? Maybe first thing they would have not understood my question. They may be attentive, may not attentive in the class, or there may be a lack of interest to answer my question. So this might be. So first thing, immediate response will be I can ask the student why there is no answer for my question, and I may again ask the question, repeat the question once again because they may not be attentive or may not understood the way I would have asked the question. So I may change and ask the question in a simple way. And a long-term strategy based on the students asking them, why are you not answering the questions? What is the problem? Based on that, long-term strategies can be framed. That is what from group 4, sir. Thank you.
Thank you. Thank you so much, ma'am. And I think this was actually the scenario which we were kind of having right now. I have given questions, but nobody was answering. Everybody was remaining silent. So yes, as you mentioned, either they have not understood the task or the assignment, or they are probably not interested. But thank you for bringing that out. Let's move to the fifth group, the fifth scenario. If anybody has discussed that, we would love to hear your perspectives. So the scenario is during clinical posting, students spend more time on their phones than observing patients. Group 5.
And other people share their views. Hello?
Yes, ma'am.
Can other people share their views if and there is no problem, or from group 5 if no one is responding?
Yeah, sure. Please.
So the scenario was during clinical posting, students spend more time on their phones than observing patients. So first of all, we need to remind them about the objectives of the clinical posting. So we have to explain what are the key observation learnings and what opportunities they will get in clinicals to learn more than classroom. And we can restrict mobile phone use also for educational purpose or any emergencies. And we can monitor participation and provide them constructive feedback regarding about their performances and what activities they can do in clinical. And we can assign them some observational tasks too.
Okay, yes.
So,
Thank you, ma'am,
thank you.
for sharing this. Would somebody like to give a go for the scenario 3 as well? I think that is a fairly common scenario which uh, you all must be going through at times.
Good evening, sir.
Yes, ma'am. Please, good
Sir,
evening. Please go
I
ahead.
would like to add some more points on this scenario number 4, sir.
Okay, please go ahead, ma'am.
Yeah, scenario number 4, it was students are not answering your questions, and most of the time it can be due to some fear also. Sometimes they are not answering, and maybe it might be the habits also, it might be the classroom environment also, that also can be a reason they are not answering also. And it can be, why does this happen? Because maybe they are having the fear of giving the wrong answer, and sometimes low confidence, and sometimes it can be due to previous negative experiences. They might have answered something wrong, and they might have got not a very good response from the teacher's side of, and also peer pressure or fear of being judged also. That also can be a reason. And maybe there is a classroom culture also that is happening. Most of the time when teachers ask the questions, only a few students usually respond. So that also can be a reason which I feel key students might be silent in the class also. And coming to the
Absolutely
immediate
agreed, ma'am. Yeah, absolutely agreed. A lot many reasons. So, any strategies to overcome this? How can we help our students overcome this barrier?
Yeah, immediately I feel ki we can just means give a moment to think also. Give a moment, like immediately don't expect the student to respond and give an answer. We can give some time also for them to think, and maybe we can rephrase the question. We can try that option also. As teachers, we know how to question in different ways also. And sometimes the students, we can make the question in exactly what it is. More than that, what do you think about the question, with a question like that, so they can have their opinion also, like that supportively we can ask the question also. And try as much as from the side of the teacher to reduce the fear among the students to make the mistakes. I mean, giving the wrong answers. At least they try to give the answer. This is a learning space, and let them try to improve themselves. So that can be the immediate response, I feel. On a long-term strategy, it is very important to provide psychological safety for the students, which is very, very important. But when you give psychological safety, always you need to, as a teacher, we need to understand that key, it should not allow the students to say anything in the class also. That is also very important. So that is something I feel, and set the expectations, and what madam told also. Then use active learning case scenarios, which will be driving their interest in the class, and asking different levels of questions and all those things. So that's all, sir, from my side.
Thank you so very much, ma'am, for sharing all your perspectives on this point. So, and thank you everyone for engaging all those who were there in the discussions. So, finally, to summarize and close, I want you all to kind of reflect on this for yourself. I will not ask you to share it out or vocalize it, but this is just for you individually. So think, after listening to the discussions and interactions and listening to your peers today, I would want you all to think for yourself about one classroom practice which you will start doing from tomorrow in your class. What will you do differently? And at the same time, one habit which you would like to stop in the classroom. The idea is to ensure that we are able to better connect with our students, So think about what you will do differently and at the same time what you will not do. Okay, I think reflecting on these two points for your own selves will help to bring about a change. So to summarize some practical tips, what to do to have a better uniform, what to say, support from the students in the class. Remember them, call them by names, set the expectations early, move around the classroom, ask open-ended questions, appreciate the participation of students, use silence as well effectively, and stay calm. And don't argue with the students, don't embarrass your students, don't be dependent only on PowerPoint. Because many of you were mentioning that the students nowadays are just not interested in the books and the notes. They are ready, happy with the chat GPT and the notes which we can easily get from the internet. So why should they come to you? So they will come to you, they would be listening to you, they would respect you only if you are able to give them something beyond those notes which is there, and that is your experience and your wisdom. Don't talk continuously for an hour, but give them opportunities to talk and share their concerns and experiences as well. And don't ignore repetitive disruptive behavior as well. So yes, if somebody is being repeatedly disruptive, we need to address that separately. So finally, take home message. Effective classroom management is not about controlling students, but it is about designing an environment where professionalism, participation, respect, and learning, they all naturally flourish together. So with this, I end my presentation. Thank you all for being here and participating actively or being passive listeners, but thank you for being present today. Thank you, everyone.
Thank you,
So
sir.
back to the organizers.
Thank you very much, sir, for your insightful, engaging, and thought-provoking session. Your practical guidance on managing classroom dynamics, encouraging student participation, handling challenging situations, and creating positive learning environment has provided all of us with valuable strategies, and that can be immediately implanted in our classroom. Now, it's a time of an interactive session. I request participants to post their question in a chat box, and I invite Dr. Gaurang sir to kindly address the questions from our participants.
If there are any questions, participants can put their questions in the chat box.
Like during the session, there doesn't seem to be any question which they have.
Yes, sir.
Thank you.
Thank you, sir.
As we come to the close of today's enriching session, on behalf of KD Institute of Nursing Sciences, I extend my heartfelt gratitude to Dr. Gaurang Bakshi sir for sharing his invaluable knowledge, rich experience, and practical insight with all of us. I sincerely thank each one of you for your active participation and enthusiastic engagement. A feedback form will be shared with all participants after the session in WhatsApp group, and we kindly request all to take a few moments to complete it and share your valuable suggestion. Also, I request all the participants.
I request all the participants to kindly switch on their videos for a few minutes.
Dear all participants, this was our first day, so there was some technological glitches in the first day, but we definitely definitely assure you for any group activities because there are few comments from the participants. We'll definitely take care of these things as it was a first day and first experience of our participants to have like uh, breakout room facilities. From tomorrow onwards, we'll priorly inform you in the group about any activities to be held, and we request all the participants to stay online and active in online platform. This is only 1 hour we are taking the sessions, and we in there address that how to give enough time for each students in the clinical, as there will be only 2 faculties for 50 students. One,
So can I
Mr.
respond to
Surendra Kumar
that?
has been asked. Yes, sir, please.
Yeah, but before I share, I would like to ask for whether anybody from the audience would like to respond to this question. How do you teach effectively in the clinicals with less faculty and more number of students? Any strategies? I'm sure many of us would be, your ideal ratio 1:10, 1:20 is still also a huge number. Even 1:10 is still a huge number. So how to make clinical teaching more effective? Would anyone like to share how you handle your clinics?
போலீஸ் ஸ்டேஷன் நல்லா பேங்க்ல தான் ரொம்ப டைம். ஆமா.
Okay, so I think there are many, managing the time is definitely a critical challenge in the clinical setup, where the emphasis is patient care. At the same time, we need to ensure that good quality clinical teaching is happening. So there are many models available to kind of teach students in a busy clinical environment. The 1 minute preceptor is one of those models. I'm sure if you can look up literature, just put up the OMP model and you will. 1 minute stands for it's symbolic, but 1 minute it indicates that even in a busy clinical setting, it is possible to teach students in a short period of time. Basically, we need to, in the clinical setting, different students will come with different backgrounds and different levels of prior knowledge and experience. So, from the way the students are talking and presenting and taking the cases, we need to first diagnose what are the learning issues with the students so that we can give specific feedback customized to the individual students' needs. And the 1 minute preceptor is one model which you can go through. I'm sure it will help you to make better and effective use of your clinical time available.
Yes,
How
thank
to
you, sir.
encourage, one more
Sir,
question, how to encourage students to actively participate in the class and write rough notes during the lectures. So again, these many interactive strategies, but if you want the students to make their own notes after during the class, you need to kind of give them, build in the time within your classroom. Say after 15-20 minutes, ask them to reflect on what was just covered. Give them 5 minutes to make their own notes. So if you want them to prepare rough notes, build in the time in your formal lesson plan and encourage them to do it. But if we just expect them to write their own notes after the class is over, probably a lot would be missed out. So give them breaks during your teaching and ask them to give them specific instructions to follow. Yes, somebody has raised their hand.
Yeah, Geeta from Bangalore.
Yes, ma'am. Please go ahead.
The teaching method can be participatory, not only lecture. It can be accompanied by participatory learning. You can give a situation wherein they can role play that, or we can have some brainstorming sessions with regard to pathology and other things, the diagnosis, differential diagnosis. They can have a brainstorming session. With regard to care, they can role play. So that will be multifaceted learning.
Absolutely, ma'am. So we need to come out of the lecture mode and use different methods of student engagement
Yeah,
think
participatory learning.
participatory learning and many more active learning strategies can be used to gather and retain the attention of the students and help them improve on their knowledge. Thank you.
Basic the notes need not be a detailed one. It can be headings can be given so that they can develop from what they observed and what they did.
Yes, ma'am. Thank you.
The participation, they can be given incentives like a certificate or something new so that they'll be involved. They need not think that it's a boring or something like that. So their innovative should be appreciated. Apart from classroom, in the general session, they can be highlighted, put in the board, like that. They'll be encouraged to participate and learn also. Sir.
Thank you, ma'am, for sharing your perspectives. Thank you. Okay, so there don't seem to be any more questions now.
Yes, sir. You can leave, sir. Thank you, sir. Thank you so much.
Thank you so much once again.
Thank you, sir.
Thank you, sir. Our next session will be held tomorrow from 11 a.m. to 12 noon. The Zoom meeting link and session details will be shared with all registered participants via mail and WhatsApp group. So we look forward to welcome you again for another session. Thank you once again. Have a wonderful day. Thank you.
Ma'am, 1 minute. What will the topic be, ma'am?
Thank you.
Ma'am, what is the topic for tomorrow?
Mentoring and supporting today's students.
Yeah. Thank you.